Hi everybody, welcome to NUR714. This presentation is on health promotion and disease prevention. The CDC utilizes the social ecological model, and it's a theoretical framework that identifies different factors that influence health, and for our purposes, mental wellness at 4 key levels. The idea is to prevent illness before it occurs. So community leaders could utilize this framework in order to formulate risk reduction strategies or even advocate for specific preventative strategies within their specific populations of focus. So the 4 different tiers include the individual level, the relationship level, the community level, and then the societal level. So at the individual level, we're identifying biological and personal factors that might predispose individuals to poor mental health outcomes. That could include their age, education, income, substance use history, abuse history, and then prevention strategies at that individual level would be promoting social emotional learning, educational initiatives, promoting positive attitudes and beliefs towards mental wellness as a whole, teaching self-care behaviors to individuals. Then as you move to the relationship level, you're looking at close relationships that might increase risk of mental health disorders. So you're looking at peer relationships, partner relationships, family members, parent-child relationships. Prevention strategies at this level would include strengthening communication between those individuals within the relationship, promoting healthy relationships, promoting positive peer norms. Then you move to the community level, and here you're looking at community resources, schools, neighborhoods, workplaces. And within that community, prevention strategies could include addressing neighborhood poverty, ensuring safety within the community, promoting equality among the members of that community. Then you switch to the societal level, and within the societal level, you're looking at laws, policies, systems like the educational system, for instance, the health economy of that society, the health equity across that society. And prevention strategies at the societal level would be improving education, creating employment opportunities, ensuring job security, addressing those social determinants of health within that society. When you're talking about social determinants of health, you're talking about different factors that impact health inequalities, health inequities, health outcomes, and overall life trajectory for people within that population of focus. So you have 2 options. You could target whole populations, or you could just target those identified as high risk. And Healthy People 2030 identifies 5 domains that influence health, well-being, and quality of life. Those key social determinants of health include education access and quality of education, healthcare access and quality of that healthcare access, neighborhood and built environment, social and community context, and then economic stability within that population of focus. So now we'll shift into different modalities of disease prevention and the promotion of mental wellness. So primary preventative measures are those that prevent mental health problems from occurring. This is the most cost-effective method, and this is meant to reduce the incidence of mental health disorders. So primary prevention is occurring before any established problem, and the main goal is to reduce or eliminate risk factors that would predispose individuals or communities or larger populations even. So examples of this could include preventing certain types of dementia that could be caused by vitamin deficiencies. So if we could think about the social determinants of health, right? If we could somehow increase the quality of access to nutrition for individuals, if we could ensure that individuals are not vitamin deficient, if we could eliminate that risk factor, then maybe we could prevent dementia, for instance. Then we talk about secondary preventative measures, which are all about screening, early identification of mental health disorders. The hope here is to decrease the prevalence of mental health disorders. Here, we're talking about prevention in that latent stage of a disorder where it has begun but prior to anybody becoming symptomatic. So it's an early departure from health. For example, screening for problematic drinking behavior that would precede diagnosis of an alcohol use disorder. Finally, we talk about tertiary prevention, and most of healthcare up to this point in our times has really focused on tertiary prevention, and at present we're seeing a shift towards more weight being placed on primary and secondary preventative measures. But the mental health field, psychiatry, is definitely behind on that still. So here we're talking about treatment, decreasing the severity of and the disability caused by mental health disorders. We're trying to minimize negative outcomes. So tertiary prevention is essentially implementing those interventions for treatment of an existing mental health disorder already. And an example of this would be providing psychosocial treatments to reduce morbidity and mortality among individuals with mental health disorders. So to recap, we discussed how primary prevention is the reduction of risk factors, right? Secondary preventative measures are all about screening and that early identification. And then tertiary measures are treatment measures, right, of an already existing mental health condition. So what is our role as psych mental health nurse practitioners within these preventative measures? So at the primary level, we could be advocates for positive attitudes towards mental health and wellness. We could engage with our lawmakers and hopefully make a positive impact on mental health related policies, laws within our communities. We could be a link to local resources for those individuals in our communities and our societies. We could promote education within our communities, within the school systems in our communities, within the adult centers within our communities, any sort of venue in which you could be involved, right? Then at the secondary level, this is already in practice. You would be assessing for abuse, for trauma history. You would be checking labs for screening purposes. You would be utilizing those screening tools. I listed a few of them here for you guys. Telephone hotlines, crisis intervention, disaster response is all at that secondary tier as well. So if you think about when mental health personnel is deployed after a disaster response has already taken place to hopefully step in before the development of PTSD, right? So they had some sort of incident take place and we're trying to treat them within that acute stress moment. To prevent any further deterioration. It's in that early moment. And then tertiary treatment, right, is where we do most of our medication management, psychotherapy treatments and modalities, and then any type of rehab services as well. Thank you all for listening to this PowerPoint presentation. I hope that it was of help to you and that you were able to learn something about health promotion and disease prevention.